diagram for it to just...
Have you ever wondered how we choose topics for our health and wellness programming? Hello, I am Lucy Hernandez. As Washington Hospital's Community Outreach Project Manager, I am responsible for our community engagement programs, including our health and wellness seminars, Women's Health Conference, Think Pink event, and many others. Every 3 years, we conduct a community health needs assessment. This assessment helps us to select topics for community outreach and engagement. In the following video, Tina Nunes, Associate Administrator of Ambulatory Care and Rehab Services at Washington Hospital, presents the 2016 Community Health Needs Assessment Report to the board members of Washington Township Healthcare District. At Washington Hospital, we are committed to ensuring that our community has access to the latest health information. We hope that you find the presentation informative and invite you to share what you learned with your friends and family in the Tri-City community.
A little bit of background. The Affordable Care Act was enacted by Congress in 2010, and as part of that act, it stipulated that tax-exempt hospitals must conduct a community health needs assessment every 3 years. The guidelines require that nonprofit hospitals adopt an implementation strategy plan of the health needs that are identified. This was the second assessment since the ACA was enacted. Now, even though it was a requirement as of 2010, as a district hospital, we were exempt from the legislation requiring this prior to the ACA. But being a district hospital, we felt it was very important to participate in the community needs assessment, and we've been doing it for over 20 years in terms of developing programs and services. Programs such as the Health Insurance Information Service, we have our community mammogram program, and as recently our low-dose CT screening program have come out of the community needs assessment. So first, a little bit on the process and methodology. So both quantitative and qualitative data were gathered during this process. Washington Hospital collaborated with 11 local hospitals and worked with a company called Applied Survey Research in order to gather the information. In terms of quantitative data, as always, data is several years behind when we're doing this. Quantitative data was collected through various reports, including the Alameda County Public Health Department, the California Cancer Registry, the California Department of Public Health, and OSHPA. Also, as part of this process, we did a qualitative data collection, and this was conducted through several focus groups. We had focus groups with professionals, we had focus groups with residents, and we had key one-on-one interviews. And it spanned a number of topics, including aging and family services, emergency services, low income, mental health, and women's health, just to name a few. So to start with, in terms of the district, for Washington Hospital, the primary service area is defined by voting precincts. So our district, as you are very well aware of, is Fremont, Newark, Union City, unincorporated Snow, and Hayward. For Hayward, it's the two southernmost zip codes of Hayward, 94544 and 94545. But 94545 is a golf course and there's no residential homes on it. So for purposes of this report, 94544 is used. The other thing to note through this report is unincorporated Sunol has a very small population. It's less than 1,000 people. So just keep in mind that relatively minor differences in numbers through this report can appear larger, and you're going to see that in the slides that come up. So to start with, the Tri-City population has been growing over the years. The Tri-City population was 352,995 people in 2015. This is an increase of approximately 15,000 since 2013. In terms of race and ethnicity, the district has a very diverse population. The Asian population is the highest ethnicity at 44%. Now, the Asian population includes Indian, Asian, Filipino, Chinese, and Japanese, so just keep that in mind. White is the second highest ethnicity at 30.8%, and the next is Latino of any race at 23.3%. So when we break that down into the Tri-City area, so for the ethnicity breakdown by city, Fremont has 52.2% of Fremont are Asian, which is a slight increase from a year ago. White is the second highest ethnicity at 29.3%, which is a slight decrease from the year prior that we were reporting on. And next is Latino of any race at 14.1%. In terms of Newark, 37.9% of Newark are white, which is a decrease from the year prior. Second highest ethnicity is Latino of any race at 33.1%. Again, a slight decrease from a year prior. And next is Asian at 29.5%, which is a slight increase from the year prior. And in terms of Union City, 51.8% of Union City are Asian. Second highest ethnicity is Latino of any race at 22%, and next is white at 21.2%. In terms of the age of the population, next 3 slides are going to show Fremont, Newark, and Union City. So for Fremont, 36.7% of the residents are between 20 to 44 years of age, with the median age of 37.4. For Newark, 36% of the residents are between 20 and 44 years of age, with the median age of 38.2. And for Union City, 37.8% of the residents are between 20 and 44 years of age, with the median age of 37.1. So in terms of the uninsured, the percentage of uninsured slightly dropped across the board from the previous report, with the exception of Sunol, which remained the same at 4.5%. And I think since the 2014, we've seen this number decrease. In terms of life expectancy for most cities, it increased slightly from 2010. The overall life expectancy compares favorably with the national level in Fremont, Union City, Newark, and Hayward. Sunol was just under at age 78.6. Death from all causes in Fremont, Newark, and Union City rates were lower than the county and state. Hayward was not significantly higher. The highest rate is found in Sunol, and it should be noted again that small communities such as Sunol does have the rates vary a little bit. So out of this, 7 health needs were identified. We have asthma, behavioral health, cancer, cardiovascular disease, stroke, maternal and child health, obesity, diabetes, healthy living and active living, and violence and injury prevention. So we're going to go ahead and go into each of those. So the first being asthma. This slide is showing the asthma emergency department visit rate across the state, county, and cities. The rates are per 10,000 population. The top 2 bars shows the state and county asthma emergency department visit rate at 49.9 and 76.9 respectively. Fremont had a notably lower asthma emergency department visit rate at 39.3, and Newark and Union City and Sunol had higher emergency department visit rates compared to the state average. In terms of asthma prevalence, the proportion of adults with asthma was higher in Newark than in Fremont and Union City. Newark is at 16.1%, Fremont at 15.6%, and Union City at 15.2%. All cities had higher adult with asthma compared to the county and state. Data was not available for Sunol as the numbers were too small. So in terms of this slide, it's showing asthma prevalence in children and teens. There were more children and teens in Fremont and Union City that had asthma than in the county and the state. And again, for this slide, Newark and Sunol, there was no data available. So in terms of through the community input, through the one-on-ones and the focus groups that were conducted, the community expressed concern about childhood asthma. Residents said asthma is a bigger deal in elementary schools. And the other thing was, depending on the time of the year, according to residents, there can be a high number of pediatric respiratory issues. So those are some of the things that came out of the focus groups. So in terms of what Washington Hospital offers in terms of programs, although current programs are predominantly adult-focused, we are exploring means to address childhood asthma. Some of the services that are currently offered are our pulmonary rehab program, which is the one-on-one counseling and support services. We offer the Better Breathers, which is a very active support group here in the community. And also we do a number of education and screenings throughout the year for the public that are free to the community. So the next is behavioral health. The rate of emergency department visits for mental health illness problems was much higher in Alameda County than the state. It was also high in the cities of Newark, Union City, and Sunol. Self-inflicted injury emergency department visit rates was lower in Alameda County than the state, and it was also lower in the cities of Fremont, Newark, Union City, and Sunol when compared to the county and state. The emergency department visit rate for substance use was higher in both Alameda County and the city of Sunol than the state. Fremont, Newark, and Union City were all below the state average. In terms of intentional self-harm, the death rate due to suicide was lower in Fremont, Newark, Union City, and Alameda County than the state, but much higher in Sunol. So in terms of the focus groups and what was heard through the focus groups and the one-on-one interviews, the community members felt there is a lack of mental health providers. Residents reported a lack of information as to where and who to speak with to obtain those services. Community members had expressed poor discharge procedures and lack of follow-up after mental health emergencies. Participants said there was a lack of placement care and behavioral health services for adolescents, and residents reported that a lot of mental health providers do not accept their insurance. In terms of, there are a number of efforts that the hospital is taking to address this health need. I think most notably, Nancy, I think you've heard that has begun preliminary discussions with Alameda Health Systems to explore a possible collaboration to increase access to mental health services here in the South County. Part of this effort was developing a matrix highlighting really the lack of services that are here in the South County. Other efforts include crisis counselors in the emergency department and also community education through our health and wellness. Most recently, we did do a health and wellness program on understanding mental health disorders with Dr. Seema Siegel, and it was very well attended, and we are now in the process of developing an educational series on mental health disorders for the community. So the next area is cancer. So cancer is the second most common cause of death in the United States and in California. For the cancer health needs, the report provided cancer case counts by city. The count is the number of new incidences for that year, and it is not age adjusted. So the count for Fremont is 717, and of course it's higher than the other cities because Fremont has a higher population. This was slightly up from the prior reporting period. Newark and Hayward counts were slightly higher for 2013 than the prior year. So now we're going to break it down in terms of breast cancer. The incident count of breast cancer in Fremont was 131, a little lower than the prior year. Newark and Hayward were slightly higher counts than the prior year. So for cervical cancer, the incident count for cervical cancer in 2013 in Fremont was 8. The others were too small to have a reporting statistic. In terms of colorectal cancer, the incident count for colorectal cancer in Fremont was 58, a slight decrease from the prior year. The incident count increased for Newark and Union City from the prior year. In terms of lung cancer in Fremont, it was 75, same as prior year. Newark, Union City, and Hayward all slightly decreased from the prior year. The incident count for prostate cancer in Fremont was 90, a decrease from the prior year. Newark, Union City, and Hayward all increased from the prior year. In terms of the quantitative community input, community comments mainly focused on the transportation issues and the difficulty in getting to and from treatment. That's the main thing that came out of the focus groups. So Washington Hospital has a number of programs. It's very extensive in terms of the range of cancer programs and services. I think most notably recently with the opening of the UCSF Washington Cancer Center, which is a strategic affiliation that provides district residents with local access to essentially the latest technology and care. Other programs include the Infusion Center, the lymphedema services, and education, just to name a few. And of course we do a variety of screenings as well for the community free. The hospital offers a number of support services, including support groups, and we have nurse navigation in addition to community education. Washington Hospital receives several accreditations and awards related to cancer, including the American College of Surgeons Commission on Cancer Outstanding Achievement Award. It should be noted that Washington Hospital was one of 2 hospitals to have earned this distinction 3 surveys in a row. So it's a really good accommodation. So the next is cardiovascular disease and stroke. Heart disease is the primary leading cause of death in the United States, and stroke is the 3rd leading cause of death in the United States. So in terms of heart disease prevalence, in Fremont, Newark, and Union City, and the county, they were lower than the state. Data was not available for Sonoma. In terms of coronary heart disease hospitalization rates, in Newark, Union City, and Sonoma, they were higher than the county and state averages. However, Fremont hospitalization rate was just below the county. Overall, there was an increase in heart disease hospitalization rate from the previous reporting period. Deaths due to coronary heart disease, which was much higher in California than the Healthy People 2020 objective. So just to note, the Healthy People 2020 is a set of goals and objectives with 10-year targets designed by the Department of Health and Human Services. So that's what that indicator is related to. Fremont, Newark, and Union City and Sonoma all increased from the prior reporting period and were higher than the Healthy People 2020 goal. In terms of congestive heart failure hospitalization rates, Union City had a very high rate. Fremont, Newark, and Sonoma were below the county average. In terms of stroke hospitalization rate, Union City's stroke hospitalization rate was higher than the state and the county, and data was not available for Sonoma. So in terms of the community input through the focus groups, residents said that in specific geographic areas, there are few to no supermarkets or farmer market offering healthy foods, and there is a lack of access to open space for exercise. Key professionals noted that they are seeing an increase in the number of Afghani and Indian residents with cardiac problems, and that there are a lot of multiple diagnoses. And key professionals noted Latinos and Blacks tend to have a higher level of hypertension and other risk factors. So in terms of Washington Hospital, we offer a number of cardiac services, including cardiac rehab, mended hearts, and community education. And of course, we are a cardiac receiving center as well here at Washington Hospital. In terms of stroke services, we are certified as a primary stroke center by the Joint Commission and designated as a receiving center for strokes here in Alameda County. We also offer a number of support groups and screenings, and we do provide community education throughout the year. So Washington Hospital, as I said, received several accreditations and awards relating to heart health and stroke prevention. Most notably, the Joint Commission granted Washington Hospital full recertification of its Advanced Primary Stroke Program. The hospital received no recommendations for improvement, which is the highest outcome possible for recertification. We also were awarded awards from the American Heart Association and from Healthgrades. So the next area is maternal and child health. So the percentage of families living below the federal poverty level in the county and district cities were lower than the state. Other Alameda County indicators were identified. In 2014, 14.9% of the population in Alameda County reported experiencing food insecurity at some point during the year. Infant mortality, low birth weight, and prenatal care in Alameda County were better than or similar to the state averages and the Healthy People 2020 objectives. In terms of the community input, residents reported they felt sexual health education and general healthy decision-making for teens was lacking. So in terms of maternal and child health and the services that we offer, you can see on this slide that we offer a number of services. To address food insecurities, the hospital coordinates with Alameda County Food Bank and CalFresh programs to ensure that low-income families have access to healthy, fresh foods by donating 400 to 600 pounds of food each year. The hospital also donated funds to Tri-City Volunteer Food Bank and Thrift Store towards the purchase of a mobile food pantry to increase access to healthy food to underserved communities. Another item to note is Washington Hospital will be soon opening the prenatal diagnostic clinic as well. So the next section is obesity, diabetes, healthy living, and active living. Union City had a very high diabetes hospitalization rate compared to the state. Newark had a high rate compared to the county and state. And Fremont and Sonoma were below the county and state. In terms of diabetes-related indicators, this slide is showing the percent of children grade 5, 7, and 9 within the obese body composition category. Youth obesity was alarmingly high in Union City and Newark, above the state and the county. The percent of children in Alameda County who are physically inactive was slightly higher than the state, and all cities were below the county and state averages. Food insecurity was also identified as an indicator in Alameda County, with 14.9% of the population experiencing food insecurity, which is higher than the state. Alameda County has a higher density of fast food restaurants as well, which was noted. And according to the U.S. Department of Agriculture, food insecurity is associated with chronic health problems in adults, including diabetes, heart disease, high blood pressure, obesity, and mental health issues, including major depression. So in terms of the community input, we heard that community members complained of a lack of access to healthy foods. The community felt it was expensive to eat healthy. Residents were experiencing food insecurities, and families are stretching 1 week's worth of food to 3 weeks, trying to. Community members said there was a lack of affordable sports and recreational activities for youth and adults. And the community believed that culturally familiar food is unhealthy. Eating healthy isn't always a top priority for new immigrants. Eating food that is familiar to them provides comfort. And residents said health providers do not give culturally specific nutrition recommendations. As previously mentioned, the hospital coordinates with the Alameda County Food Bank, CalFresh, and Tri-City Volunteer Food Bank. To meet the needs of diabetes, the Hospital Outpatient Diabetes Center offers a variety of programs, including individual and group classes, a monthly education series known as Diabetes Matters, and they also provide a support group. And during the summer months, Washington on Wheels Mobile Health Clinic provides free glucose screenings throughout the district. Additionally, the hospital offers a number of free health and wellness seminars, including prevention and treatment of diabetes. And then, of course, we air everything on our InHealth television station, and we also have it on our website. So the next section is violence and injury prevention. Unintentional injury emergency department visit rates in all cities in Alameda County were below the Healthy People 2020 objective. The death rate due to homicide was higher in Newark and Alameda County than the state and the Healthy People 2020 objective. The death rate for pedestrians killed by motor vehicles was much higher in Union City than the county, state, and the Healthy People 2020 objective. So here are some of the things that we heard from the focus groups and the one-on-one interviews. Residents worried about being attacked when they walk along the streets. Community members felt there's a lack of empathy from healthcare and law enforcement towards victims. Regarding domestic violence, community members reported a lack of effective screening for domestic violence victims. Often, domestic violence victims are prevented by their abuser from having a primary care provider. Poor communication or lack of connection between health clinics and domestic violence organizations for referrals. And there are not enough providers and facilities for domestic violence victims. Here's a list of the items that hospital is currently doing to address this need. To highlight just a few of them, we've established a relationship with SAVE, Safe Alternatives to Violent Environments. The hospital's worked with the City of Fremont to make improvements to enhance the pedestrian safety at the Civic Center Drive crosswalk. And most recently, Washington Sports Medicine acquired the iSync cognitive assessment tool to test for concussion or other cognitive impairments. So next steps on the community needs assessment. Today was really about presenting the data to the board. The next step is to develop a 3-year implementation plan to address the identified health needs, which will come ultimately to the board in a future board meeting.
We hope you found the presentation of the 2016 Community Health Needs Assessment Report informative and enjoyable. To view the report in its entirety or for more information regarding Washington Hospital's community outreach events and programs, please contact us at 510-494-7009 or visit our website at whhs.com. Thank you for watching.